I'm not quite sure for how long. We're just going to check in on the numbers around COVID and also things like the vaccine, how they're working, what we're learning about them. Professor Heidi joins us. She's Program Director for Disease Elimination, which is a good thing, at the Burnet Institute. Professor, thanks for joining us.
Hi, Ralph. Thank you.
Just a very broad question. What are you seeing about the various vaccines? How do you think they are proving themselves right now?
Yeah, look, all of the vaccines are showing that they can certainly reduce very severe COVID infections, reducing hospitalisations and deaths. And the vaccines have a variable level of efficacy against reducing the symptoms of COVID-19. And, a year ago, we would have been amazed to see a vaccine on our doorstep already. So this is fantastic news for controlling the pandemic.
How long until we know if it stops people giving the virus to each other?
Yeah, that's a really good question. So at the moment, we don't know if the vaccines generate enough immunity that actually stops the virus from being transmitted. So we know that they reduce the symptoms associated with COVID, but it's possible that the people who didn't report symptoms in the trial were still infected and that they could still pass on the virus to someone else. So I think what's going to be most instructive here is what's happening in countries that are using the vaccines at very high rates and that also have high rates of transmission. So, of course, Israel and the United Arab Emirates are really good examples of that. In Israel, they've delivered 50.3 doses of vaccine per 100 people. So they aim to have 80% of the population vaccinated in February and 95% in March. So that's going to be really instructive for understanding how quickly the rate of new infections come down and as a consequence then the rate of hospitalisation and death. But you have to also interpret that in conjunction with all of the public health control measures that are currently happening in that country. So I think we need to see vaccines as another tool in our toolkit along with all the public health measures and restrictions on travel that we currently have. And it's really important that globally we get yeah, sure.
I mentioned Israel for a few reasons. I mean, because it's small and they've got a decentralised health system, they're able to vaccinate so many people so quickly. But they also had a terrible experience the last few months. They've obviously really struggled to get people to follow public health directions. How do I interpret? So I see these little studies out of little pockets of Israel. Huge qualifier. Vaccines haven't rolled out in the Palestinian territories. But I see the vaccine being rolled out and I see people rolling out that vaccine saying, hey, wow, our transmission rates dropped a lot.
Yeah.
That is good. That's a really good signal, isn't it?
That's a fantastic signal, and what we'd like to see are more examples of that in other countries such as the UK, Germany and other countries, the US, that are trying to implement their vaccine programs as quickly as possible and that also are struggling with controlling the coronavirus. I think also some modelling might be really instructive here to see how countries that are currently not vaccinating as quickly compare to countries who are vaccinating as quickly. So it's going to be a big data analysis effort, I think, to understand how much the vaccines have contributed to reducing those new infections.
The other thing I really don't understand, I read criticisms of the way the vaccine is being rolled out. And the people writing those articles say, look, it will affect the mutation of the virus in this way. Is that something I need to pay attention to? And do the countries that are rolling out the vaccines in particular ways, do they have a choice?
Well, no, they don't have a choice at all at the moment. They need to get this vaccine into as many people as possible, as quickly as possible. I think Australia is in a fantastic position here because we have no community transmission. It means we can develop full immunity from the vaccines without ever encountering the virus in that critical period where your immune response is building up to its maximum level after those two vaccinations. So in other countries, though, they're struggling with really high numbers of deaths. So they're trying to vaccinate as many people as quickly as possible. And, of course, there are logistical challenges with that because, especially with the Pfizer vaccine, with the storage requirement, you need to reserve enough doses to have enough vaccine to give people that second dose in the optimal period.
Does it matter which vaccine we get in Australia?
Well, I think at the moment the way it's panning out is I think any of the vaccines are going to be a fantastic choice for Australians. They all prevent severe COVID. We've just recently heard the results from the Novavax trial. These are interim results that show that their vaccine was 95% effective against the circulating virus that was more closely matched to the vaccine itself, and 89% effective against the UK variant. So Australia has subscribed to 50 million doses of that vaccine, and that's going to be another great tool in our toolkit for our vaccine program. So with the variants that are emerging, we've now seen that all of the vaccine manufacturers are now starting to produce vaccines or think about producing vaccines with these new variants to more closely match the vaccine to the circulating viruses of the future. So it's likely that in the future we'll be seeing vaccines that contain these new variants so that they match the viruses that are circulating at the time.
And how confident can I be of that? I mean, to be honest, I forget. I have to read an article every week just to remind myself how the vaccines work. But they're adjustable. Like, as the virus varies, should I be confident that the vaccines can vary with them?
Yeah, I mean, I think what's really amazing with this COVID-19 pandemic is the amazing advances that have happened in vaccine technology. The mRNA vaccines are probably the quickest ones to modify and create new vaccines matched circulating viruses. The viral vector vaccines are also relatively quick to modify into new strains that are circulating. So that gives us an incredible advantage now that we've never had before with these new technologies coming into human use. So I think Moderna and Pfizer, AstraZeneca will all be ramping up production of new variants of this vaccine in the future so that we can have really good coverage against what's circulating around the world.
What are you looking for in the next few months? Like, what are the news or what are the developments you're keen to find out about in the next few months?
Yeah, look, I'm really keen to find about the effectiveness of the vaccines. I think that's a key question. What happens in Israel, the UK, Germany, the United States, it's really going to be instructive to understand how quickly the vaccine can reduce new infections and hospitalisation and death. I think that's the number one thing we're all hanging on the edge of our seat to find out with these vaccines.
And so when you mention effectiveness, I mean, I read, one vaccine's 90% effective. Are you keen to see some in-the-field data to see whether the trial matches the population in the real world? Is that what you mean?
No, I mean whether the vaccines actually prevent transmission and how quickly they can actually prevent new infections from occurring in the population.
Fingers crossed, fingers crossed. Thanks so much for joining us.
Thank you.
Professor Heidi Drama, Program Director for Disease Elimination. So that's the program she directs, Disease Elimination at the Burnet Institute.